It doesn't choose a political party. I am sure that all of us here have our own parties. Ebola does not choose to only infect the movement or the LUB or the FDC or there are so many political parties, I'm forgetting, UPC. Ebola doesn't choose. Ebola does not choose any religion. It does not choose any culture. But of course, if you have Ebola and you start performing the traditional circumcision, you are at a very high risk. Very high risk. Don't attempt, because you don't know who is infected. Ebola, I also heard from my friend Dr. Ryan here, does not look at your bank account to choose whether your bank account is loaded so that it comes to you, or your bank account is empty and it comes to you. Ebola affects anybody and anyone. And it can, any of us here is a candidate. So let us avoid politicizing Ebola. And I know why that question came. Because usually, when the Ministry of Health declares an outbreak, like the PS declared the outbreak on our behalf, then people start saying the Ministry of Health is looking for money. They have run out of money, they are looking for money for themselves. We are health workers. Anybody that is part of a task force addressing health is a health worker. And when I say health worker, even the RCC here is a health worker. Even the RDC there is a health worker. Even you, the press, when you report on health, you become a health worker. But the professional health workers swear, and we swear to save lives first and do no harm to anybody. So there is no reason whatsoever why you should declare a false alarm when there is no outbreak. There is an outbreak. And the first question I asked the leaders here was whether they believe there is an outbreak here, and all of them said yes. So there is an outbreak. That is why it was declared. We don't declare outbreaks politically for any reason. No. If it was politically, then we would be declaring outbreaks every month. Why not? But why should we declare an outbreak in 2022, then in 2025? That is not political. There is a real outbreak. And we don't declare outbreaks because we are looking for money. But we need money to control outbreaks. You cannot control an outbreak without resources. You need resources to deploy people on the ground for commodities. You need resources for fuel, transport. You need resources to treat the sick. We need the resources. And that is why, one of the other reasons why we declare, because when we declare, then partners like WHO will come down in solidarity and support the response financially, but also with human resource and knowledge and wisdom. And then other partners will also mobilize resources from within their resources. You have seen several partners have been here. When they hear the declaration, that is like Lukhobo. They say, yes, there is a problem. Let us go and support. That is even done in our communities. When you have a problem, you make noise and people come to support. But we are not going to export that challenge to them. We are going to control it from within. And that is why me and you must work together. But it also helps them to prepare, especially those that border Uganda. They also get prepared. But allow me to reassure them that no case will leave Uganda to take infection out. We have never allowed that to happen. It will never happen. And want to reassure the international community that Uganda has control this outbreak, and we are not going to export any case anywhere. Uganda remains extremely safe. Please come and visit Uganda. That is a very important question. The good news is that we are all government, isn't it? Including yourself. So I could actually turn the question back to you and ask you, how are you prepared? Because your preparation is extremely important. Not only what you're calling government, which is a system. Government is all of us, and all of us must be prepared to bring this outbreak under control. But to put it in the context that you want, the government of Uganda, since the year 2000, when we had our first Ebola outbreak, has been building capacity to control outbreaks in this country. So we are able to detect on time, and we are able to respond on time. And many of you are aware that we have had several outbreaks. If I talk only about Ebola, this is our 8th Ebola outbreak. But we have had other outbreaks as well. And you have been moving with us along as we control these outbreaks. So government has a number of systems in place. And when we talk about detection, there is prevent, control, and detect. If we talk about detection, we build capacity with laboratories. Here in Mbale, you even have a mobile laboratory within the hospital. That is being prepared, so that the samples are delivered there and you receive your results in real time. And for Ebola specimens, real time is 4 hours. We don't have to take the samples to Kampala. We don't have to take the samples to Mbale. Anywhere in Uganda where an outbreak happens, we can position laboratories. We also have a system for us to communicate information in real time through our emergency operation centers, which are in all the regions of the country. And these emergency operation centers are all linked to the Central Emergency Operation Center that is at the Ministry of Health headquarters. We have vehicles in place. You remember the COVID vehicles? Everywhere for surveillance. We have emergency medical services, that is the ambulance system that is interconnected the entire country. But most important, we have you, the media and the communities, who are the most important in this outbreak. So our being here in Mbale is not about the government system of preparedness, because the government system exists, and I have not highlighted all, I've only picked a few. Our being here is to empower you people with information, is to tell you that you need to engage more with the communities, is to keep you vigilant and alert, is to emphasize the fact that we must work in solidarity to bring this outbreak under control. And that is why we came in solidarity. We need everybody to participate. So the answer to your question is that yes, we are prepared. The update is that we have Ebola cases in the country, and they are receiving treatment and they are improving. The update is that we are still carrying out intensive surveillance to pick any case, if any exists within the communities, and we need you to report any suspected case on time to us. We have already set up isolation facilities for purposes of treatment. In that isolation facility, we have 3 separations. We have for suspected cases, we have probable cases, and we have the confirmed cases. And if they are confirmed cases, they will go there after laboratory confirmation. So don't ask us cases, whatever. That is not important. What is important is that you get to the communities and tell them they need to protect themselves and they need to pass on information. What is Ebola? A viral infection that presents with a fever, joint pains, general malaise, bleeding from the body openings, the mouth, the nose, the gums, you name it, the anus, any body opening. And when you see such a presentation, please report to the nearest health facility. What is important is for them to know that our index case of Ebola passed through Mbale Hospital and also interacted with a few people in the communities. That is why we need the community to be vigilant so that we can pick out the cases from the communities. What is important for you to pass on is that the outbreak will be stopped by the communities. They are the only ones who can control. It is not the government system that you're asking about. Outbreaks start in the communities and end in the communities. And so we need the communities to rise up and, be vigilant and say we don't want Ebola in our community, so we are going to educate one another and we are going to weed out all suspicious cases to the facilities. And Ebola will end, just like it ended in Kasanda and Mbale. Should the community be, and that information, please take it from me to the communities. We appreciate them. They have been our most valuable asset. The fact that Uganda is known for controlling outbreaks on time is because of the Ugandan community. Because they listen and they respond. So they shouldn't be alarmed. We just want them to respond in the right way. Educate one another, report any suspicious case, do not be alarmed. Everything will go well and we shall end this outbreak on time. I thank you. Safe for our tourists to come in, not only tourists, even those who want to travel, even those who want to trade. You're not very far from the border with Busia and Malaba. Please go ahead and trade. Even when we have an outbreak, we don't restrict tourism, trade, and travel. In any case, the outbreak is in well-defined areas. It is not widespread all over the country. Uganda is very safe. And I repeat again, Uganda is very safe. And we encourage all tourists to come to Uganda. We encourage trade, we encourage travel. And we are here, we have traveled from Kampala, we are here. And we have found the people of Mbale very alive and well. All of you look good. Okay? So, when you are passing on information, please let the tourists know that our hotel facilities are available. The tourism sites are very safe. They are free to move. The transport systems that they travel in are very safe. They are free to move. Every other thing in the affected districts is under control. And it will not affect them. Monkeypox, and they visit the commercial sex workers. But there is no threat of Ebola anywhere where the tourists will go. You asked about that the index case visited Mbale, visited the regional hospital, and visited the traditional healer here in Mbale. I don't know where. You are the people who know. But you're also aware that the index case died in Malaba. You're also aware that the children visited Jinja and some of the other clinics that he visited. So those are the areas that we are following up. Only those areas are areas of concern. However, we encourage the rest of the country to remain on alert and remain vigilant, because Uganda is prone to epidemics and anything can happen anywhere. So remain on alert, remain vigilant, report any suspected cases. Uganda has always controlled any epidemic. This is the 8th Ebola epidemic, and you are still alive. The very person who asked the question, have you ever got Ebola? Because wherever you go, you see our people in action. But like I said before, the most important people are the population. So they don't need to be alarmed. They just need to be calm. All we need to do is to get out those with suspicious signs and protect ourselves. How do you protect yourself? Number one, please avoid contact with any person with suspicious symptoms and signs. Fever, high-grade fever, vomiting, diarrhea, bleeding from the mouth, the gums, all the body openings. Report those cases. If you have somebody who is sick at home and you're not very sure, please use protective gear. At your home, I mean. Use a glove, but quickly inform the medical personnel to come and see the patient. They will come. There are ambulances that are set ready for that. Do not share clothing with the sick people. Don't share beddings with the sick people. Wash your hands with soap and water at all times. That was not only for COVID. That is one of the things that the population of Uganda forgot. When COVID, when the number of cases went down and it became no longer a public health disease of concern, everybody stopped washing hands. But washing hands with soap and water must never stop. It is a standard procedure. For always, not only in the face of outbreaks, for always, it is a standard procedure. Or use hand sanitizers. And that is also for you, the press, because the whole day you're moving around with your cameras looking for information. You even forget to wash your hands. Please wash your hands and avoid contact. Pass on in the communities. And sometimes it is not reported. Sometimes the communities don't even care about the signs and symptoms. They just proceed to bury. But I will also combine with what we are doing. Should any case die of Ebola, we have only had one case, the index case, who has died. But should any case die of Ebola, we carry out what we call safe burials, safe, dignified burials. What do we do? The relatives are informed. We accept 1 or 2 or 3 members of the family to identify their loved one. From a distance, you can see from a distance, you can see that that is Okelo or Domo or whoever. That is our person. And then we put you in our body bag and zip. And our people will ensure that a grave is dug and you are buried safely. We allow a few members of the family to attend the burial. We don't want more than 10 or 15 members. I don't remember the maximum number we allow for the burial. 15 only, and you stand at a distance. We allow a religious leader to be present to say prayers, and then we bury. And when I'm saying we, I mean the safe burial teams. They will be there, well dressed in their gear, because when we are burying a case of Ebola, we want to avoid spreading infection. And we humbly appeal to the religious and cultural leaders, do not perform rituals on the bodies, because we know that our brothers from the Muslim religion clean the body. We discourage that when a person has died of suspected Ebola or confirmed Ebola. Please do not perform rituals. That is why the safe burial teams take charge of the body and bury. That also goes for the cultural leaders and the Christians. Avoid any kind of ritual on bodies. Let the burial teams take control and bury the dead. Do not exhume bodies that have been buried. Do not exhume bodies for whatever purpose, because that body is highly infectious, and you spread infection to the community when you make that mistake. So allow the burial teams to carry out the burial. And should the burial teams decide to bury your relative, please do not resist. Do not refuse, do not resist, because they will be guided by the entire task force. Remember, I said there are deaths that occur in the communities, and unless samples are taken for confirmation, we don't know. But none has so far happened, we are not aware. Last, Sudan, Ebola. The Ebola variant we have is Ebola Sudan. There are trial vaccines because they are still under research and the World Health Organization is monitoring. So when we get opportunity like this, we use it and we get the information that we need. We need to know how protective it is, how long the protection lasts. But what you people need to know is that for Ebola Zaire, we have a vaccine that whose research was concluded, and WHO will talk about it. For Ebola Bundibujo, because we've had all these variants in this country, we don't yet have a vaccine, and we don't even have a trial vaccine. But for this one, we do have. And we have already started giving the people at risk. Those are the contacts. And we have given contacts here in Mbale, we have given contacts in Kampala as well. So over to you.
So, ukugo tulina mu ggwanga ng'abakozi baffe, abasawo baffe, abantu tekiniko bamanyi ekyokukola buli lwe tuba tufunye obulwadde buno. Edda twali tetusobola kukola test wonna ne tukola ekigwanire, n'olwekyo obusobozi tulina. We tutaali omulwadde ono bwe yagenda gye yagenda yonna, tulina obusobozi abakugu baffe bano abanoonyereza bagendera ddala mu byalo ne bakozesa okukuba bonna betuyita contact bonna babafuna bonna era tubalina bonna. So n'olwekyo obukugu bwe tulina omulwadde bw'aba Ebola era tulina obukugu okusobola okumujjanjaba, ate abasinga nga bamuwulidde aboogedde nti abalwadde baffe kati tutandise okula nti buli lwe tufuna Ebola abalwadde batono abafa. Lwaki? Obukugu bweyongedde obujjanjaba, ate kati n'ekiyonyi twafuna n'eddagala lino lye tugezesa, ate tumanyi nti nabyo bijja kutuyamba okukendeeza abalwadde abafuna abafudde mu community, contacts maybe between okubanga tetumanyi. Community yetuyamba bulijjo okulwanyisa obulwadde buno, n'olwekyo era nekati tugamba community era yejja okulwanyisa obulwadde buno era esobola okutuyamba netubuziyiza mangu ddala mu budde obutono ennyo. Ekirala kyetukoze minisita kyatalageddeko ekyokuteeka abantu ku booda nga bakebera abantu ate ku airport, kubanga ekyo kituyamba okulaba nti tewali muntu yenna asobola okugenda n'obulwadde ebweru. Era kikatirizako minisita n'agamba tetutwalanga obulwadde bwaffe ebweru era tetugenda kutwala. Era ne buno bannayuganda abatulira mwenna nti abalwadde baffe bonna abayi oba contacts bonna tubalina era tewali muntu anaatwala obulwadde bwonna. Uganda ayongedde okukatiriza nti Uganda eri safe okukola emirimu gyayo, eri safe abalambuzi okujja, eri safe n'abaamaguzi okujja ne bizinesi, abakola bizinesi bajje mu ggwanga nga tewali abakwata ku mukono. Uganda eri safe. Ate ekirungi tumanyi obulwadde bwe bwatandikira betuyita contact bonna twabafuna, n'olwekyo n'entambula n'emirimu gyabo gyonna zigende mu maaso, n'amasomero gagende mu maaso, ne bizinesi zigende mu maaso. So tewali kitugaana okukola emirimu gyaffe nga bulijjo. Naye kitukatirizaako kuffe mwenna abatuwuliriza nti mubeere nga muli alert, mulabe omuntu bw'aba mu makaago oba bw'omanyi nti nga mulwadde ng'ali obubonero obwo obwa Ebola, musujja, mutwe, otaba n'amaanyi, ennyingo ezimuluma, kivaamu n'asesema n'addukana, ekivaamu n'atandika okuleeta omusaayi, tubuulire ku nnamba eyo gye tubawadde nga IC yabawadde.
The issue with life is not whether there's a problem. There are problems all the time. The question is, are you aware of the problem? Are you managing the problem? And will you end the problem? And I'm very convinced that Uganda is very aware of the problem. It has communicated openly with WHO and international partners. It is a plan to deal with the problem, plans that have been in place for many years. This is not the first time that Uganda has had to deal with a disease like this. It has successfully done it each and every time. And it's very, very important. The disease is in a very limited number of places, in a very specific chain of transmission, for which all of the contacts have been identified. And for the first time in Ebola Sudan, a vaccine has been deployed. With the vaccine is an RVSV vaccine. It's a vaccine that's based on the same technology that was used to develop the Ebola Zaire vaccine. In laboratory studies, it's proven highly effective at preventing infection. Human studies have shown it to be safe, but it is still under evaluation, and as such, it's under a full research protocol being led by Makerere University's Lung Institute, by the Ugandan Virus Research Institute, led by Ugandan science, overseen by Ugandan science. We are here to provide solidarity, some monitoring, some support to make sure that the process is as smooth as possible. Uganda, the government are not only and the research institutes are not only doing a service for the people of Uganda, they're carrying out a service for the people of the world. Just like the people in Guinea did with the Sasufi trial for the Ebola Zaire vaccine, and then subsequently in Congo, where both of those events proved the effectiveness of the vaccine, and it is now licensed and available for all countries. We would like to have a similar situation for the Ebola Sudan strain. I would personally like to thank the Minister, the Principal Secretary and the Government of Uganda for this international engagement of solidarity with us, the global community. And I'm here with Cassandra, with Patrick, with Andrew and everyone else at WHO. We are your servants. and we're here to serve Uganda in the best interest of the people. The vaccine has not been given to everyone. We have proven in other outbreaks, and the Minister mentioned this disease passes from person to person. It's not in mosquitoes, it's not in the drinking water, it's not going through the air. The vaccine, or the virus spreads through direct contact between individuals. And there's a chain of transmission. It's like a chain where the disease passes from you to another person, and from the other person to their family potentially, or somebody else, whoever you meet and touch when you're sick. So in that sense, what we've tried to do is identify everyone at risk and try to vaccinate them. What we hope is that the vaccine will reduce the chance that they will get sick. But even if they do get sick, what we've seen with the previous Ebola and Zaire vaccine is that the disease may not be as severe in those who get vaccinated. So two benefits. So I would encourage anyone who is a contact and feels sick, come get diagnosed, because with vaccination, with access to therapy, and again, Uganda has achieved amazingly low mortality in previous outbreaks. Come to where the doctors and nurses are trained, the Ugandan emergency medical teams who are trained to give the highest possible care, to use therapeutics, to give vaccine to contacts as well before. We believe we can get the mortality associated with this virus down to very low levels. Uganda has already done that previously. With vaccine, with excellent intensive care, I think it could become even lower. So I think Uganda, on the one hand, it's a challenging time, but on the other hand, Uganda should be very proud, very, very proud of what it's doing to contain this virus, and what it's doing to build global knowledge for the future. So my feelings today are those of gratitude, those of respect, and a massive contributor to global knowledge, a massive contributor to global health security. And when Uganda faces an issue like Ebola, we come because we work for you. You are our bosses. Uganda is the boss. We have 194 member states. They are the people who own our organization. They are the shareholders. We are the servants. So we're here in solidarity to serve the people of Uganda and the government of Uganda. Thank you. The United States is still engaged with Uganda on this response, and there are investments coming in the response from the United States, to which we're all very grateful. The issue of potential withdrawal of the United States from the World Health Organization, and we're very saddened by that prospect. As I said, 24 years ago here in Uganda, we spent months in the field with Ugandan colleagues, with colleagues from CDC, with colleagues from the United States government. I have served for more than 30 years, side by side, in the same tents, sharing the same vehicles, sharing the same food with many colleagues. So I'm saddened and disappointed that that might happen. And we hope that that won't proceed. But let me reassure you, WHO's capabilities to support outbreak response remain undiminished and undiluted. Within hours of the Minister and the Permanent Secretary announcing the outbreak, we were sending large sums of money to support the response here, and we will continue to do whatever it takes to do that. So let me reassure you that that's a global matter, and it's a process that's happening. It will not affect our capacity to support the government of Uganda, but obviously we will have to look at the long-term consequences for WHO as we go through the process with the United States. But this may take a year or 2 years to complete. So sometimes in life you need to worry about the crisis you have. If your roof is burning, you're not worried about building a wall around your house. Okay? You deal with the thing you're dealing with. Right now we're dealing with Ebola and supporting Uganda. We will deal with the other issue in due course.
The reason is that we be able to see them and we don't assume they are or not. Because when we get them, our teams will come, investigate, take samples, and ensure if somebody is contaminated, the surface will be contaminated, and move this patient safely so that it doesn't continue to contaminate others. I wanted to add individuals. We have teams and we have individuals who put on like again on the going to the moon, and these are our own. We need to be kind to them. I know in one place they were harassed and the population was very harsh towards them. Please, they're just doing their job, and they're doing their job to protect the population. Be kind to them, don't harass them, and actually appreciate that they're doing a very difficult job, which you need to take them. Further, because some people may die, and we don't know whether they have died of Ebola, to some individuals, those we may draw some samples and test them to ensure that they have not died of Ebola. And this is what we call tighter surveillance. And the aim here is to make sure that we don't leave any stone unturned. And as the minister said earlier, that there are a combination of interventions. No single intervention is effective, but whichever small intervention there is very important for us, be it looking for individuals that have been exposed, be it at the facility when you are testing your temperature, or asking you questions, sometimes may be disturbing, please understand, so that we are able to get samples quickly, test them. We are glad we have a lab which arrived just 2 days or 3 days after when the outbreak was detected. This capacity, I think, not many countries do have it. And of course, when we isolate individuals, actually for the good of the population. And of course, our biggest tool, Honorable Minister and the colleagues in the press.
We responded and brought the dead body and made it safer to stay where we were able to put it. Early in the morning, our teams, the SDD, Safe and Dignified Value Team, the laboratory and epidemiology team. They swung in action, they took samples, and they are handling the body. So the body will be buried by our teams, and the results should be ready today, because by the time we started this meeting, the lab had already started the processing. So be rest assured that we shall, every process has been handled by